My name is Dr. Philippe Halbout. I'm the Chief Executive Officer of the International Osteoporosis Foundation since 2016. And my mission is to ensure in the foundation the financial sustainability, but also to lead the strategy and the operations in the foundation under the supervision of the Executive Committee and the Board of the foundation. The International Osteoporosis Foundation is the largest global organization focused on osteoporosis, fragility fractures, and also related musculoskeletal diseases. One of the key missions of IOF is also to drive policy changes as a strong requirement to influence in the long term, in a sustainable way, the health policies to improve the patient care. The International Osteoporosis Foundation has definitely the capability to have a broad vision of the burden represented by osteoporosis and fragility fractures. The proportion of the aging population in Asia Pacific is going to reach 1.3 billion people in 30 years. The proportion of people aged 65 years and more was 6% in 1990 and grew to 9% in 2019. This proportion is again going to reach 16% in 2050, making 1 in 6 people aged 65 years and more in the world. The burden we anticipate in the future is definitely huge and requires to take actions right now if we want to manage or control somehow this burden and the consequences on society. And I think that a lot of people ignore that after a hip fracture, 1 patient in 4 is going to die in the coming year due to the fracture. But what about those who survive? The survivors will lose their social life, connection with the others, capability to work and so on. The burden of osteoporosis and fragility fractures is going to be absolutely huge. In order to mitigate the consequences of this predictable crisis on the population, the IOF strongly believes in the commitment and in building synergy between all the organizations working in the bone field area. The Asia-Pacific Consortium on Osteoporosis, namely the APCO, is a group of experts from several countries in the regions charged with developing tangible solutions to the substantive challenges involving osteoporosis management and fragility fracture prevention in this most populated and fastest growing part of the world. Among other missions, APCO is so far focused in making recommendations in order to support or to motivate reconsideration of the health policy focused on osteoporosis and fragility fractures. As CEO in the IOF, I'm really pleased to be part of the APCO and its Executive Committee to bring a global perspective into these regional challenges. But also, due to its unique position as a global organization, I'm also really happy to share possible successful initiatives taken in other regions of the world as a source of inspiration for the APCO strategy and operations. The APCO framework is a document recently released by the APCO giving details on 16 minimum clinical standards including screening, diagnosis, management of osteoporosis, treatment, and targeting high-risk patients. The rationale of this framework is really to engage, to commit the national societies, the policymakers, the healthcare professionals, and all the major stakeholders working in the bone field area in order to motivate notably the local guidelines focused on osteoporosis and fragility fractures. The release of the APCO framework was based on 2 parameters: the heterogeneity of the guidelines in the different countries, the emerging of new themes not taken into account in the existing guidelines. The major themes that emerged was systemic integration of case identification and management at all levels of the health systems, such as capture in the fracture liaison services. Another was the stratification of the individual fractures. The third one was the role of sequential therapies, and finally, the use of health economics to inform intervention thresholds and identification for specific case of osteoporotic treatment. The APCO framework is a great piece of work aiming to give recommendations to highlight standards of care in order to motivate the authorities in each and every country in Asia Pacific to reconsider or to update their guidelines. This APCO framework will significantly decrease the burden of osteoporosis and to improve the care of the patient suffering of osteoporosis and at risk of fragility fractures.